Question 1. A nurse is caring for a patient who suddenly develops shortness of breath. According to the Clinical Judgment Measurement Model, CJMM, what is the nurse's first action? A. Generating solutions. B. Recognizing cues. C. Taking action. D. Analyzing cues. Answer: B. Recognizing cues. Rationale: the first step in the CJMM is recognizing cues, which involves identifying significant pieces of information, signs, symptoms, lab values, relevant to the patient's condition. Shortness of breath is a major cue. The subsequent steps are analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. Question 2. A 72-year-old patient with pneumonia has a SpO2 of 88%, is restless, and uses accessory muscles to breathe. Which cue is the most urgent priority for the nurse to address? A. The patient is 72 years old. B. The patient has pneumonia. C. SpO2 of 88%. D. The patient is restless. Answer: C. SpO2 of 88%. Rationale: an SpO2 of 88% indicates severe hypoxemia, which compromises oxygen delivery to vital organs and is an immediate threat to life, airway or breathing or circulation priority. While restlessness, D, is a sign of hypoxia, the objective SpO2 value is the critical cue requiring immediate intervention. Age, A, and diagnosis, B, are context, not acute problems. Question 3. After recognizing and analyzing cues, a nurse develops several potential explanations for a patient's worsening condition. In the CJMM, this step is known as A. Prioritizing hypotheses. B. Generating solutions. C. Evaluating outcomes. D. Taking action. Answer: A. Prioritizing hypotheses. Rationale: prioritizing hypotheses is the third step of the CJMM, where the nurse considers the most likely explanations or diagnoses hypotheses for the patient's condition and determines which ones are the most critical to address first. Question 4. A nurse is administering medications to a patient. The nurse uses the rights of medication administration and checks the patient's identification band. This action is primarily focused on which aspect of clinical judgment? A. Ethical considerations. B. Evidence-based practice. C. Patient safety and risk management. D. Collaboration. Answer: C. Patient safety and risk management. Rationale: the use of the rights of medication administration and ID checks are foundational strategies for patient safety and risk management, specifically preventing medication errors and ensuring the correct patient receives the correct treatment. Question 5. A patient is refusing a life-saving blood transfusion due to religious beliefs. The nurse's actions are guided by which ethical principle? A. Beneficence. B. Non-maleficence. C. Justice. D. Autonomy. Answer: D. Autonomy. Rationale: autonomy is the ethical principle that respects the patient's right to self-determination and the freedom to make informed decisions about their own healthcare, even if the nurse disagrees with the decision. Question 6. The nurse reviews a patient's electronic health record and finds current best practice guidelines for managing the patient's diagnosis. Applying this information in care demonstrates: A. Intuition. B. Evidence-based practice. C. Critical reflection. D. Delegating care. Answer: B. Evidence-based practice. Rationale: evidence-based practice (EBP) involves integrating the best available research evidence, like clinical guidelines, with the nurse's clinical expertise and patient values in the decision-making process. Question 7. A patient is stable, but the nurse anticipates a potential complication based on the patient's diagnosis and trends in vital signs. This ability to foresee potential problems is an example of which critical thinking skill? A. Interpretation. B. Inference. C. Evaluation. D. Explanation. Answer: B. Inference. Rationale: inference is a critical thinking skill that involves drawing a conclusion based on evidence and reasoning. In this context, the nurse uses data, vital signs diagnosis, to infer a potential future risk or complication. Question 8. The nurse has a limited amount of time and must delegate tasks to an unlicensed assistive personnel, UAP. The nurse should only delegate tasks that are A. High risk and complex. B. Required critical thinking. C. Within the UAP's scope of practice and competency. D. Performed only during the planning phase of the nursing process. Answer: C. Within the UAP's scope of practice and competency. Rationale: effective delegation is a key component of clinical judgment. The nurse must ensure that any delegated task is appropriate for the delegatee's, UAP's, scope of practice and confirmed competency to ensure patient safety and adherence to legal standards. Question 9. Which statement by a student nurse indicates a need for further instruction on the decision-making step of generating solutions in the CJMM? A. I need to consider all possible interventions. B. I will select the intervention with the highest priority. C. I will think about the resources I need. D. I will formulate patient goals and outcomes. Answer: D. I will formulate patient goals and outcomes. Rationale: generating solutions involves determining the most appropriate interventions for the prioritized hypotheses. Formulating patient goals and outcomes, D, is actually part of the planning step in the nursing process, which aligns with prioritizing hypotheses and setting the stage for generating solutions, but is not the solution generation itself. Question 10. During a shift report, the offgoing nurse gives vague information about a patient's change in condition. Which communication strategy should the oncoming nurse employ to promote safe clinical judgment? A. Accept the vague information and rely on the chart. B. Interrupt the nurse and report the change to the charge nurse immediately. C. Use SBR, Situation Background Assessment Recommendation, to request clearer information. D. Document the vague report and move on to patient assessment. Answer: C. Use SBR, Situation Background Assessment Recommendation, to request clearer information. Rationale: SBAR is a structured communication tool that ensures clear, concise, and focused exchange of information, promoting collaboration and safe, informed clinical judgment. Relying on the chart alone, A, or moving on, D, may lead to missed cues, and immediately reporting B before seeking clarification is premature. Question 11. A nurse administers a medication. 10 minutes later, the patient reports a rash and difficulty breathing. Which step of the nursing process is the nurse primarily engaging in by reassessing the patient's response? A. Assessment. B. Diagnosis. C. Implementation. D. Evaluation. Answer: D. Evaluation. Rationale: evaluation is the final step of the nursing process, where the nurse determines the patient's response to the intervention's implementation and whether the goals were met. Reassessing the patient after an intervention is a crucial part of this step. Question 12. A nurse is considering whether to use a new, minimally invasive dressing technique that has shown promise in research, but is not yet standard hospital protocol. Which action is best for the nurse to take? A. Implement the new technique immediately on all relevant patients. B. Discuss the research and feasibility with the unit's clinical expert or manager. C. Disregard the new technique, as it is not yet standard protocol. D. Use the technique only on patients who volunteer for the trial. Answer: B. Discuss the research and feasibility with the unit's clinical expert or manager. Rationale: applying evidence-based practice requires professional collaboration. The best action is to discuss the new evidence with colleagues, such as the clinical expert or manager, to assess its appropriateness, potential risks, and the process for implementation according to hospital policy. Question 13. A patient with diabetes has a blood glucose of 45 milligrams per deciliter. The nurse administers an ampoule of D50 per standing order. This immediate action aligns with the step of the CJMM clinical judgment measurement model, known as A. Analyzing cues. B. Prioritizing hypotheses. C. Taking action. D. Evaluating outcomes. Answer: C. Taking action. Rationale: taking action is the fifth step of the CJMM, which involves implementing the selected high-priority intervention solution. In this emergent high-priority scenario, hypoglycemia, administering D50 is the immediate, life-saving action. Question 14. A patient with a head injury becomes increasingly difficult to arouse. The nurse recognizes this change and understands it suggests increased intracranial pressure. The nurse is engaging in which critical thinking skill? A. Applying standards. B. Self-regulation. C. Interpretation. D. Analysis. Answer: D. Analysis. Rationale. Analysis involves examining and organizing the data, cues, and determining the relationships between them. The nurse is connecting the cue, decreased arousal, with the underlying physiological process, increased intracranial pressure, through complex analysis. Question 15. A nurse is caring for 4 patients. The nurse determines that the patient with an acute change in mental status and new onset of confusion should be assessed first. This decision is an application of which prioritization framework? A. Maslow's hierarchy of needs. B. The nursing process. C. Time management principles. D. ABCs, airway, breathing, circulation. Answer: D. ABCs, airway, breathing, circulation. Rationale. An acute change in mental status and new confusion can indicate compromised circulation, e.g., poor perfusion, or airway or breathing issues, e.g., hypoxia. The ABCs framework dictates that issues affecting immediate physiological stability must be addressed first. Question 16. A nurse makes a medication error and reports it to the charge nurse and the appropriate hospital system. This behavior is an example of A. Justice. B. Accountability. C. Beneficence. D. Fidelity. Answer: B. Accountability. Rationale. Accountability is the ethical and legal concept of being answerable for one's actions, including acknowledging mistakes, reporting them, and taking steps to mitigate harm or prevent recurrence. Question 17. A patient reports a pain level of 8 out of 10, but is observed laughing with a visitor. The nurse decides to give the ordered PRN opioid analgesic. This clinical judgment is based on which consideration? A. The patient is likely drug-seeking. B. The nurse must respect the patient's subjective report of pain. C. The nurse must consult with a provider before administering the dose. D. The objective observation contradicts the subjective report. Answer: B. The nurse must respect the patient's subjective report of pain. Rationale. According to current standards of practice, pain is what the patient says it is. The subjective experience of pain 8 out of 10 is a primary determinant for pain management, regardless of objective behaviors, respecting the ethical principle of beneficence and the patient's subjective report. Question 18. To improve clinical judgment, a nurse regularly reflects on past patient situations, analyzing what went well and what could have been done differently. This process is known as A. Critical evaluation. B. Critical reflection. C. Intuitive thinking. D. Inductive reasoning. Answer: B. Critical reflection. Rationale. Critical reflection is the intentional, systematic process of thinking back on an experience and analyzing it to learn from it, with the goal of improving future practice and clinical judgment. Question 19. A nurse is reviewing a patient's plan of care and notes the expected outcome is patient will ambulate 100 feet in the hallway by end of shift. This statement is found in which phase of the nursing process? A. Assessment. B. Diagnosis. C. Planning. D. Implementation. Answer: C. Planning. Rationale. The planning phase involves setting patient-centered goals and expected outcomes that are specific, measurable, achievable, relevant, and time-bound smart. Question 20. Which action demonstrates the nurse utilizing the principle of confidentiality in clinical judgment? A. Discussing a patient's prognosis with the patient's family members in the waiting room. B. Accessing the medical record of a neighbor admitted to a different unit. C. Providing a verbal report to the physical therapist about a patient's mobility status. D. Sharing a patient's sensitive diagnosis with a friend who is also a nurse on another floor. Answer: C. providing a verbal report to the physical therapist about a patient's mobility status. Rationale. Confidentiality requires that patient information is only shared on a need-to-know basis for the purpose of patient care. Providing a report to the physical therapist for treatment purposes is appropriate collaboration, while the other options violate patient privacy and confidentiality. Question 21. A patient post-operative day 1 is receiving a continuous morphine PCA infusion. The nurse notes the patient's respiratory rate is 8 breaths per minute, and the SpO2 is 90% on room air. The patient is difficult to arouse. According to the CJMM, which action demonstrates the highest priority in the prioritizing hypotheses step? A. Hypothesize that the patient's pain is poorly controlled. B. Hypothesize that the patient is experiencing opioid-induced respiratory depression. C. Hypothesize that the patient has developed post-operative pneumonia. D. Hypothesize that the patient is fatigued from surgery. Answer. B. Hypothesize that the patient is experiencing opioid-induced respiratory depression. Rationale. The immediate cues, bradypnea, low SpO2, difficult to arouse, point to acute opioid-induced respiratory depression, which is an immediate life threat, ABCs. This hypothesis must be prioritized over pain, A, chronic fatigue, D, or less acute processes like pneumonia, C, because it requires immediate intervention, e.g., Narcan, ventilatory support. Question 22. The nurse is implementing a new evidence-based protocol for central line dressing changes. This demonstrates which element of clinical judgment? A. Intuitive thinking. B. Applying scientific rationale to practice. C. Ethical reasoning. D. Critical reflection and action. Answer. B. Applying scientific rationale to practice. Rationale. Evidence-based practice, EBP, is the hallmark of professional nursing and involves incorporating the best available research, scientific rationale, into clinical decision-making. Implementing a new protocol based on research directly reflects this application. Question 23. A nurse is reviewing an order for a medication that exceeds the typical maximum dose. The patient's condition is stable. Applying the critical thinking standard of accuracy, what is the nurse's first action? A. Administer the dose and monitor the patient for adverse effects. B. Contact the pharmacy to confirm the typical maximum dose range. C. Call the prescriber immediately to question the dose. D. Check the hospital policy on questioning orders. Answer. C. Call the prescriber immediately to question the dose. Rationale. The standard of accuracy demands that information and decisions be correct and free from error. A dose exceeding the maximum warrants an immediate safety check with the prescriber C before administration, adhering to the principle of non-maleficence. Pharmacy confirmation B is also necessary, but challenging the prescriber based on potential inaccuracy is the immediate ethical or legal duty. Question 24. A physician orders a potassium replacement for a patient with hypokalemia. The nurse notes the patient's telemetry monitor shows a new frequent, complex run of premature ventricular contractions, PVCs. This observation is a cue that alters the nurse's priority regarding the ordered intervention. Which CJMM step is represented by this altered priority? A. Recognizing cues. B. Analyzing cues or prioritizing hypotheses. C. Generating solutions. D. Evaluating outcomes. Answer. B. Analyzing cues or prioritizing hypotheses. Rationale. The nurse must analyze cues connecting hypokalemia to the PVCs and subsequently prioritize hypotheses, recognizing the life-threatening dysrhythmia risk is now higher than the hypokalemia risk alone. This synthesis and change in priority illustrate the core of these two linked CJMM steps. Question 25. A patient refuses an invasive procedure, but the family insists the nurse proceed, citing the patient told them to do whatever the doctor says. The nurse advocates for the patient's refusal. This action most clearly reflects the ethical principles of A. Justice and fidelity. B. Autonomy and veracity. C. Autonomy and beneficence. D. Non-maleficence and justice. Answer. C. Autonomy and beneficence. Rationale. The nurse is upholding the patient's autonomy, right to self-determination, by respecting the refusal. By preventing an unwanted procedure, the nurse is also acting in the spirit of beneficence, doing good and acting in the patient's best interest, by protecting their choice and body integrity. Question 26. A patient with a chronic respiratory condition is readmitted for the third time this year. When planning discharge education, the nurse decides to use a teach-back method with visual aids tailored to the patient's low literacy level. This decision is an application of which characteristic of critical thinking? A. Consistency. B. Fairness. C. Contextual awareness. D. Intellectual humility. Answer. C. Contextual awareness. Rationale. Contextual awareness is the recognition of specific circumstances, e.g., chronic readmissions, low literacy, that influence a situation and adapting the intervention, e.g., using a specific teaching method accordingly. Question 27. A nurse identifies an issue with staffing that is compromising patient safety on the night shift, but is hesitant to report it due to fear of retaliation. Addressing this ethical challenge falls under the domain of A. Personal integrity and moral courage. B. Legal precedent and scope of practice. C. Beneficence towards the individual. D. Non-maleficence avoidance. Answer. A. Personal integrity and moral courage. Rationale. This situation requires the nurse to demonstrate moral courage, the willingness to stand up for what is right despite the potential negative consequences, to address systemic issues that affect safety, reflecting their personal integrity as a professional. Question 28. A nurse assesses a patient and determines the primary nursing problem is ineffective airway clearance related to increased secretions. In the CJMM framework, this diagnostic conclusion is part of the transition between A. Recognizing cues and generating solutions. B. Prioritizing hypotheses and generating solutions. C. Analyzing cues and prioritizing hypotheses. D. Taking action and evaluating outcomes. Answer. C. Analyzing cues and prioritizing hypotheses. Rationale. The process of analyzing cues involves clustering information and linking it to a clinical meaning, diagnosis, or problem. Prioritizing hypotheses is the next logical step, where the nurse confirms and ranks the importance of this clinical problem relative to others. Question 29. In a mass casualty incident, the nurse triages patients based on the highest probability of survival with minimal intervention. This approach is primarily driven by the ethical principle of A. Autonomy, B. Beneficence, C. Justice, D. Fidelity. Answer. C. Justice. Rationale. In disaster settings, justice, specifically distributive justice, guides the allocation of scarce resources, nurse time, equipment, to ensure fairness. Triage protocols are based on maximizing benefit for the greatest number, prioritizing those who can be saved with the resources available. Question 30. A patient has a do not resuscitate DNR order. The patient's SpO2 drops to 80%. Which action requires the most complex application of clinical judgment regarding this legal order? A. Withholding CPR and emergency drugs. B. Administering supplemental oxygen and repositioning the patient. C. Calling the family to inform them of the status change. D. Documenting the refusal of life-sustaining measures. Answer. B. Administering supplemental oxygen and repositioning the patient. Rationale. A DNR order only directs the withholding of resuscitation efforts, CPR, intubation, certain drugs. It does not preclude the nurse from providing comfort care and non-invasive interventions, like oxygen and repositioning, to improve comfort and treat reversible causes short of resuscitation. This requires careful judgment to respect the order while providing appropriate care. Question 31. The nurse receives a verbal order for a high-risk medication during an emergency. The nurse immediately repeats the order back to the prescriber before administering it. This action is an essential component of A. Risk management and communication standards. B. Legal documentation compliance. C. Interprofessional boundary setting. D. Independent nursing practice. Answer. A. Risk management and communication standards. Rationale. The readback process is a mandatory safety practice endorsed by organizations like the Joint Commission. It is a critical risk management and safe communication standard designed to prevent errors stemming from mishearing or misinterpreting verbal orders, especially in high-stress situations. Question 32. A nurse suspects a patient's worsening heart failure is due to a non-adherence to the prescribed low-sodium diet. What method of data collection is the most effective way to validate this clinical hypothesis? A. Asking the patient's spouse about the patient's eating habits. B. Reviewing the patient's daily recorded fluid intake or output log. C. Directly asking the patient about their recent diet and using open-ended questions. D. Checking the patient's most recent serum sodium level. Answer. C. Directly asking the patient about their recent diet and using open-ended questions. Rationale. To validate non-adherence, the most direct, accurate, and ethical method is to have a therapeutic, non-judgmental conversation with the patient. C. To gather subjective data that confirms the hypothesis, which is a key component of the analyzing Q step. Spouse input, A, is secondary, IOB, is objective effect data, and sodium level, D, is often a poor indicator of recent sodium intake. Question 33. After implementing a complex wound care intervention, the nurse documents the time, materials, and patient's immediate response. In the CJMM, this comprehensive documentation is crucial for which step? A. Prioritizing hypotheses. B. Generating solutions. C. Taking action. D. Evaluating outcomes. Answer. D. Evaluating outcomes. Rationale. While documentation occurs during the taking action step, its primary function is to provide the data needed for the final step, evaluating outcomes. Detailed documentation allows the nurse and other clinicians to later compare the patient's status post-intervention to the desired outcomes. Question 34. A nurse notes that two different providers have ordered two conflicting medications, e.g., one opioid, one Narcan PRN. The patient is stable. What is the most complex application of clinical judgment needed here? A. Administering the medication with the most recent order date. B. Withholding both medications and seeking clarification from both providers simultaneously. C. Consulting the pharmacist to determine which medication is safer to hold. D. Choosing one medication and documenting the rationale for the choice. Answer. B. Withholding both medications and seeking clarification from both providers simultaneously. Rationale. Conflicting orders present a significant risk. The most complex and safest action is to withhold both non-maleficence and resolve the conflict directly by obtaining clarification from both prescribers. B. Ensuring the final order aligns with the patient's current condition and care plan, which is essential to risk management. Question 35. A patient is confused and attempts to climb out of bed despite being physically unstable. The nurse determines that physical restraints are necessary to prevent immediate harm. This decision, if used, is primarily justified by which ethical principle? A. Justice. B. Non-maleficence. C. Autonomy. D. Fidelity. Answer. B. Non-maleficence. Rationale. The use of restraints is highly restrictive of autonomy, but is justified only in emergent situations to prevent immediate harm, falling, injury. The principle of non-maleficence, do no harm, dictates that preventing a major injury outweighs the restriction of freedom in this specific, high-risk context. Question 36. A newly hired nurse is observed performing a sterile procedure strictly according to the written protocol, without deviations, even when the patient's anatomy makes the standard approach difficult. According to Benner's stages of clinical competence, what level of skill is the nurse demonstrating? A. Expert. B. Proficient. C. Advanced beginner. D. Novice. Answer. D. Novice. Rationale. A novice relies heavily on rules, written procedures, and objective attributes of a situation. They struggle to adapt to variations and prioritize based on clinical relevance. This contrasts with more experienced nurses who demonstrate flexibility and contextual decision-making. Question 37. A nurse observes a colleague violating sterile technique during a procedure. The nurse waits until the procedure is complete and then privately addresses the colleague's breach of protocol. This action reflects the nursing responsibility of A. Self-regulation, B. Collaboration, C. Interprofessional accountability, D. Veracity. Answer: C. Interprofessional accountability. Rationale: interprofessional accountability is the responsibility of nurses to monitor and maintain the standards of practice within the profession. Addressing a colleague's violation of standards, particularly when related to patient safety, falls directly under this domain. Question 38. A patient's electronic medical record (EMR) flags a potential drug interaction between two newly ordered medications. The nurse checks reliable pharmacological resources and confirms the interaction is significant. This use of technology and resources to prevent error is an example of which aspect of clinical judgment? A. Critical reflection. B. Utilizing system-level safeguards. C. Intuitive decision-making. D. Interprofessional communication. Answer: B. Utilizing system-level safeguards. Rationale: the EMR flagging the interaction is a system-level safeguard, clinical decision support. The nurse's action of investigating and intervening demonstrates effective clinical judgment by actively engaging with and utilizing these system resources to ensure patient safety. Question 39. When evaluating a patient's response to an antihypertensive medication, the nurse notes the blood pressure decreased from 160/98 millimeters of mercury to 140/88 millimeters of mercury. The target outcome was 130/80 millimeters of mercury. The most appropriate next step in the evaluating outcomes step of the CJMM is to conclude: A. The intervention was fully effective and should be continued. B. The goal was partially met, and the intervention needs modification. C. The intervention was ineffective and should be stopped immediately. D. The data is incomplete, and the patient needs reassessment in 15 minutes. Answer: B. The goal was partially met, and the intervention needs modification. Rationale: since the blood pressure decreased but did not reach the specific target goal, 130/80 millimeters of mercury, the expected outcome was partially met. This conclusion logically necessitates the next step: modifying the plan of care in the next cycle of the nursing process, e.g., reassessing dose, adding another agent. Question 40. A nurse is providing care to a patient who requires a highly complex, specialized treatment that is not routinely performed in the current facility. To ensure the patient receives the optimal care, the nurse initiates a transfer to a specialized center. This decision-making process is a complex integration of A. Veracity and fidelity, B. Evidence-based practice and resource management, C. Autonomy and patient rights, D. Accountability and documentation. Answer: B. Evidence-based practice and resource management. Rationale: the decision is driven by evidence-based practice. Recognizing the best care requires specialized treatment, and resource management, understanding the limits of the current facility and effectively utilizing the healthcare system's resources to meet the patient's needs. This is a high-level application of clinical judgment and care coordination. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.